Let's go. My name is Dr. Mark Allandari. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. Hello, ACOI. As providers, we've drastically seen how the realm of public health has influenced our professional lives, whether we serve in academia, in administration, in research, in private practice, or even within the hospital setting. COVID has become synonymous with the term public health. It has dominated our dialogue over the last year and a half, and rightly so. But we also know there are a lot of other issues that deserve attention too. Now, you best know the ACOI for providing a variety of quality CME for physicians, both online and in person. More than providing internal medicine CME, the ACOI has been working diligently to keep you up to date by sharing updates on COVID-19, as well as expanding our coverage to include other public health concerns as well. And coming up next month is the ACOI Annual Convention and Scientific Sessions. Make sure you'll join us there in person in Orlando, October 27th through the 30th. I'll be there. And if you can't make it in person, you can go virtually. Can't wait to see you there, or at least can't wait to see you on video there. So, that being said, let's go ahead and get started, and let's talk about the harmful effects of vaccine misinformation. So I have to laugh when I think of all the amateur wannabe scientists out there who want to do, quote unquote, their own research before they would consider taking the COVID-19 vaccine, which, by the way, is a vaccine that is here due to the culmination of years of scientific research, which I'm fairly sure didn't include a scientist from the National Institute of Health and Infectious Diseases going on Facebook to see what his cousin's husband's father-in-law posted about the SARS-CoV-2 virus that he saw on someone's social media page. Yet, that phrase, do your own research, is emboldening individuals to make life and death choice to avoid or delay getting the COVID-19 vaccine. It is a phrase that we hear on certain news channels. Yet, funny enough, that phrase can be traced back to, wait for it, 1890s. That's right, the 1890s. See, there was skepticism surrounding the smallpox vaccine, and that phrase was commonly uttered. Interestingly, smallpox is the only human disease to be eradicated by vaccination that way. And yes, being informed is always a good idea. But when people consider research to be scrolling through their social media feed or listening to a friend's neighbor, I beg to differ to call that quote-unquote research. And yes, usually the only research people do click on is either Facebook or Twitter. God, ain't that the truth? Recently, the Wall Street Journal discovered that Facebook has taken active steps in the past few years to actually make false information more likely to spread. What? That's crazy. The algorithm they've implemented actually determined what appears in users' feeds to make people more likely to interact with posts. And because misinformation is likely to generate more interaction with reposts and shares, it accomplishes Facebook goals of higher engagement. And the problem is that Facebook needs to connect the dots of their actions. Too many Americans look to Facebook and other social media outlets as their source of news and information. And it also affirms their own beliefs, since their like-minded friends on Facebook tag and repost, giving the one who posts the misinformation nonsense, heightened sense of authority, of an ego boost. So, okay, where are we with all this? So, with massive power to spread information and misinformation to billions of people worldwide, social media outlets also take on the responsibility of seeing how people act upon the information they read on their channels. And after all, we are still amidst a historic public health crisis. In the old days, before social media, small groups would interact with amongst themselves and affirm each other's beliefs. Yet, there were victims of those actions, and that impacted far fewer people than it does today. You see, social media amplifies those small bandit groups that once had a small reach by a zillion times, and you end up with a world swimming in misinformation and consequently a world of people believing the wrong things, and those are deadly things. Yet, as a physician, I'm frustrated, and you are frustrated. Our lives and professions revolve around facts and data, scientific data to be particular, yet many of us encounter anti-vaxxers who prefer to believe unscientific claims. And unfortunately, it takes a drastic event to even have them see that what they believe is wrong, and it could be dead wrong. So take the bride-to-be who happened to have been a surgical technician who wanted to wait to get the COVID vaccine because she was hoping to get pregnant soon after her planned August wedding. She'd heard that the vaccine would hurt her chance of getting pregnant. Where did she get that? I don't know. That's false. We know that. And she finally changed her mind and in July decided to go ahead and get the vaccine. Good for her. But just days before her appointment, she fell ill, testing positive for COVID-19. And it turns out she had just returned from her bachelorette party in Nashville. She was hospitalized. She was placed on a ventilator. She died September 10th. Her funeral was held at the very church where she was planning on being wed. Her family has come out to say that misinformation killed her. And excuse me. And another story that is just as frustrating about a woman who labeled herself as a free thinker and who promoted everybody to question everything. She was 40 years old. She proclaimed to be proud, to be unmasked, unmuzzled, unvaccinated, unafraid. She even held up signs that says, "Give a voice to the vaccine injured." By the way, don't know what vaccine injured means. Anyway, I think you can guess how this ends. Her family announced on September 15th that she died after contracting COVID-19. We are now at a point that 1 out of every 500 people has died of the virus. And those are the facts. And this is the research that we need to promote to so-called anti-vaxxers. There are a litany of stories out there. What is extra infuriating is when you get misinformation from a doctor. Now, it doesn't happen much, but there are a handful of doctors promoting anti-COVID-19 vaccine messages and basically spreading lies. Now, some of whom are profiting big with their own so-called remedies. Now, there's a group of American frontline doctors promoting and spreading misinformation that have a huge following of anti-vaxxers. You probably remember one of them who, she got famous last summer for talking about demon semen. What? Anyway. That's why we have to support anything we can do to fight this dangerous trend. And one of our members, Dr. Human Chaudhry, who's the president of the Federation of State Medical Boards, is recommending that medical professionals who spread coronavirus misinformation have their license revoked or suspended. Booyah. Absolutely. So I encourage you to listen to Dr. Chaudhry, who was recently interviewed by Robin Young on NPR's Here and Now. False claims are not just harmful, but they are often fatal. That is something that Dr. Chaudhry says on the interview, and I wholeheartedly agree with that statement. The ACOI has a new podcast also called Docs Off the Clock. They'll feature Dr. Chaudhry on an upcoming podcast. He will be addressing the epidemic of misinformation about COVID-19 and the vaccine, so tune into that in the next couple of weeks. In the meantime, what we can do in the realm of public health is to continue to spread the truth that COVID-19 vaccines are the best defense in this pandemic. Recently, it was announced that those who are unvaccinated are 11 times to die of COVID than vaccinated Americans, and that is a fact from the CDC, and that's the fact that needs to be spread. And just on a personal level, as many of you know, I did go to Sierra Leone. I went to West Africa to help with the Ebola epidemic, and I just want you to know that in Sierra Leone, I think it was a total of 25,000 people that may have died of Ebola. And here in the U.S., we're 680,000. I saw and I see on a daily basis in the hospitals far more people who die of COVID and a lack, and these are folks that are dying in the hospitals as a result of lack of COVID vaccinations. Way more people than I saw pass on as a result of Ebola virus disease. So stay on the lookout for these updates. And to read more from the sources used in this report, go to the acoi.org. acoi.org/resources. Together with the ACOI. Hello, ACOI. Thank you for letting me do these videos. We'll help you have the latest information to help you respond to your patients. Always, please feel free to reach out to me directly at madairy@mac.com. We can do this together. Please stay safe. And as always, thank you, Gina, for another brilliant script.